Today, we're going to be talking about 5 surprising reasons why your nose is stuffy and what you can do about it. So just to note that this is not medical advice, so that you should talk to your doctor before making any changes to your medical regimen. It's standard disclaimer, as you can tell. So these are some of the common reasons that you hear about that explains why you have a stuffy nose. So you have nasal allergies, the common cold, pregnancy, that's pretty common, a deviated septum or nasal trauma, or pet allergy. So these are the common reasons for why you have a stuffy nose. But today I'm going to review 5 conditions that might surprise you. And some of them you may already know. I've kind of touched on this before, but some of these I guarantee you won't know about. So the first one is crooked teeth. Now, you may not be expecting this, but if you have crooked teeth, that means you're going to have a slightly high arched palate. So this is the normal width of a hard palate. And then this is an exaggerated version of a very high arched palate. Notice it's very high and deep in here, and the molars are very narrow. And what's up happening is that if the molars are narrow, that means the side walls of your nasal cavity are going to be more narrow, and your septum is going to get crushed. So it's going to get crushed like this. And so it's going to narrow your nasal cavity, which creates less room for the turbinates and nasal structures to swell up when they get inflamed. So it's going to predispose you to nasal congestion. So what are some of the options that you can do to prevent nasal congestion? So you have the standard neti pod or nasal saline irrigation, which everyone knows about. I've talked about this in detail in the past. You can use allergy medications, sprays, or pills. Again, standard treatment options. You can do surgery. So that's kind of the last stage resort, but some people need to go up that ladder to get to that point after you've tried everything else and it doesn't work. Then you can also go through dental options. So if you have small jaws, then you can expand it using orthodontics or palatal expanders, which are there are different levels of palatal expansion. That's a whole other talk in itself. Number 2 is medications. I've mentioned some of these medications in the past, for example, taking high blood pressure medications, but there are many other medications, prescription medications that can cause nasal congestion. So it's not surprising that the majority of Americans take at least one prescription medication regularly. And this survey from Consumer Reports in 2017 found that 55% of Americans take prescription medications, 4 on average, and 75% take at least one over-the-counter medication regularly. So these are very high numbers. And this is 2017, so it's probably going to be much worse now. And also, there's another study from the Mayo Clinic that found that at least 70% of Americans take at least one prescription medication, more than half take 2, and 20% take 5 or more medications. So this is a very comprehensive list of all the different medications that can cause nasal congestion. The text is very small, but the top one is aspirin and other NSAIDs, so including ibuprofen, ketorolac, indomethacin, all the anti-inflammatory medications that you find over the counter has the potential to cause nasal congestion. And then here's another ingredient that's found in many over-the-counter medications, including nasal saline, which is BKC or benzalkonium chloride. It's a preservative that's used for all these medications. But one thing that this can cause is a rebound effect, even with nasal saline. So if people get addicted to nasal saline because of this chemical, that's why you should probably make your own nasal saline or find brands that don't have any preservatives. It's also been found that BKC can paralyze the cilia that pushes the mucous membranes in your nose to the back of your nose. And then you have all these classes of high blood pressure medications, the beta blockers, the alpha blockers, and many of the other common high blood pressure medications. And the main reason how that works is that when you lower your sympathetic response, so you're lowering the sympathetic tone, it dilates the blood vessel, so the nose and the membranes in the nose gets more swollen as a result. And also, if you're laying down just due to gravity, the autonomic nervous system isn't going to compensate as well if you kind of suppress the sympathetic nervous system. And there are many of the psychotropic drugs, immunosuppressants such as cyclosporin. You have these over-the-counter decongestants like Afrin and Gerstan. These are the generic names. This is why you get addicted to it, because it works so well that you get this rebound effect. And cocaine works the same way, very strong decongestant, right? And even hormones like estrogen replacement therapy and any other medication that suppresses thyroid function as well. So there's a lot of medications that people commonly take that has a potential to cause nasal congestion. And one thing to mention about high blood pressure medications is that there's a subclass of high blood pressure medications that's used for erectile dysfunction, which is Viagra. And nasal congestion is a major side effect from Viagra. So what can you do? Basically, you should talk to your doctor about changing to another medication or make the necessary dietary lifestyle changes that I'm going to talk about But eventually your long-term goal is to come off these medications. And I know that that's challenging for many of you on this call, but it's possible. And I've seen it happen. People have come off 10, 20 medications with dietary lifestyle modifications. So number 3 is vitamin D. And this might be surprising that vitamin D is related to nasal congestion, but there's been strong studies showing that there's a direct link between vitamin D levels in nasal congestion and allergy symptoms. And here they gave a tiny amount of vitamin D, which is only 1,000 units, which is very small, to these people for 30 days. And what they noticed was that the vitamin D levels went from 18 to 29, which is pretty good. It's a 10-point jump. But remember, 30 is the bare minimum of what's considered normal. So there's still hypovitamin D levels. But the total symptom score, total nasal symptom score, went from the baseline of 10 down to 2.8. So higher is worse symptoms, lower is much better symptoms. So very significant drop in the nasal symptom scores with very small amount of vitamin D. Now, this study looked at a small group of patients, and they split them into 2 groups. One group got Flonase, which is a standard anti-allergy steroid, topical steroid spray that works pretty well. And the other group got the Flonase plus vitamin D, and this is a much higher doses of vitamin D. And so you can see how this group is evenly divided between people with high levels of vitamin D, 30 to 100, and very low levels under 20. And notice how the lower your vitamin D level, the higher your symptom score. And the higher the vitamin D, the lower the symptom score. So here, it kind of confirms the other study. But if you look at what happened after they gave the therapy, in group A, this is the group that only got the Flonase. And so before treatment, the symptom score was 12 and went down to 8.98. So it's a drop of 3.5 points. But in the group that got both the Flonase and the vitamin D, it dropped 5.34, and that was a significant difference. So what's the best way to get more vitamin D? And best way is to get more sun exposure. And obviously with modern cultures, we spend more times indoors, and doctors warn you not to get sunlight because of the risk of skin cancer. But I can argue that because you're not spending enough time in the sunlight, it actually increases the risk of other cancers besides skin cancer. Obviously skin cancer came down, but all the other kinds of cancers went up a little bit. And obviously darker skin people need a lot more sunlight. The important part is not to get sunburned. That's when you have higher risk of skin cancer. For most modern people living in temperate climates, you need to take vitamin D supplements. Now, the optimal level of vitamin D in your bloodstream is not 30, which I mentioned before, but it has to be above 50 or 60. So you have to take about either 5 or 10,000 units to get your serum level above 60. And the idea is, again, about 60 to 80. Now, on average, the vitamin D levels in the US are in the 25 to 28 range, so it's really, really low. I'm willing to bet with the pandemic, it's even lower because people spend more time indoors. Now, this is a chart I've shown before in previous talks. It's a compilation of all the studies showing the beneficial health effects of vitamin D with all these various medical conditions, like kidney cancer, heart attack, fractures, diabetes, colon cancer, various kinds of cancers. And you can see the colored boxes are levels at which studies have found some significant benefit. And so notice this is the serum level in the US measurements. And so I mentioned 30 is about here. And notice how if you go below 30, you have a very high chance of rickets. So 30 right here is only going to help with rickets, not anything else. So you have to be way beyond 30 and above 30, 40, 50. So the recommended range is actually above 60, it's like 60 to 80 to control for all of these. So notice the big difference with all the tests like ovarian cancers, breast cancer, colon cancer, lymphoma, diabetes, multiple sclerosis, kidney cancer, etc. All right, let's go to number 4, which is flimsy nostrils. I mentioned this multiple times, but a lot of people still don't think about this. They just think that nasal congestion is an internal problem. So notice on the left, you see regular sized nostrils, but when this person sniffs in, it narrows down. Now, this happens because not only is the cartilage is more flimsy, but because the nasal sidewalls are more narrow, there's less space for you to breathe in. So it just caves in a lot easier, like sucking through a flimsy straw. And the worst area that it collapses is this crease right there. And this is the junction between the upper lateral and the lower lateral cartilage. And that's the part that kind of caves in. This is called the internal nasal valve. And this is the most narrow part of the nasal cavity. Now, there are a couple of ways that you can see if you have this condition. You can all do this with me right now. Place your finger right next to your nostril, press down, and then lift up and out towards the corner of your eye. So kind of in this direction. And if you do this and you breathe better, that means you have a positive Cotton maneuver, meaning that you can breathe much better through your nose. And this is a modified Cotton maneuver where you put little sticks, or you can use Q-tips to kind of lift up the nostril. But here, notice you're going beyond the crease here to get to the upper lateral, so you get a much better effect that way, as opposed to just lifting like this. So how do you treat this? You probably know that you can use breathe right strips. But breathe rights are the brand name, but there's other generic names available, and they come in different sizes with different adhesive properties. So you kind of experiment. And then you have all the internal options that go inside the nose. And again, there are probably 20 different variations of this, all tolerated to different levels. And then if you go more formally, you can undergo a alar band graft. This is using an open rhinoplasty approach. You have to put cartilage from your ear or your septum here to strengthen the nasal sidewall. So this is done by plastic surgeons or ENTs. And this is another option that I started doing many years ago called the alar procedure. And what happens here is that you make a little cut right at this crease on the inside, and you peel the top cartilage and the bottom cartilage off just a little bit, and you overlap a couple of millimeters, and you just put a stitch in. So this stent was developed by one of my colleagues at Montefiore Einstein called the alar procedure, alar stent, and it's not being made anymore. But what I ended up doing is, because they stopped making it, I started doing the procedure without the stent, and I get really good results with pretty quick healing. It's a very minimal procedure. It can even be done in the office. Another option is a suture suspension option. We put a little tiny screw, pop it in the eye socket under the skin, tunnel the stitch under the skin, grab this nostril and loop it back up, and you suspend the nostril so it doesn't cave in. Not too many people do this anymore. It was just described about 10 years ago, and maybe probably about 24 times while I was in practice. And this is called the lateral procedure. This is done in the office. You just put a little implant on the sidewall opposite the cartilage in the bone. It's very thin, so it doesn't really show after it heals. And then this is called the Vivere procedure. This came out just at the tail end of when I used to practice. And this is a radio frequency device that's used in other medical technologies. And you put it inside the nostril adjacent to this area right there. And you kind of basically causing a slight burn of the tissues. So it stiffens the nostrils. So a very high-tech version of stiffening. So you can see there's many different ways of doing this. But most people do fine with breathe right strips. And I use breathe rights every night. It does help me sleep better. Now, one thing about nasal breathing is that, and I mentioned this many times in the past, that you have to keep your mouth closed for the breathing to work, because if your nose is stuffy and you open your mouth, the tongue goes back and you stop breathing more often. That's why it's important to keep your mouth closed. And that's why some people do better with mouth taping along with the breathe right strips. Now, number 5 is stomach juice reflux. And I'm not saying acid reflux, because it's not just acid alone that comes up. It's your entire stomach contents coming up to irritate your throat. And this will cause classic symptoms of postnasal drip, such as throat clearing, coughing, hoarseness, lump sensation, trouble swallowing, and throat pain. Now, what comes up is not just acid, but also bile, digestive enzymes, and bacteria. So it's very caustic to this area over here. Now, furthermore, it's found that even pepsin can reach the nose, the sinuses and ears, middle ears, and the lungs. And in this one study, one pediatric study on the right, they found the vast majority of these kids with chronic lung conditions had pepsin and lipid-laden macrophages in the lung washings. So anyone with chronic lung disease, even in adults with COPD, with chronic infections, this is something to look for. But the problem is that most pulmonologists only use pH meters. So it measures pHs in the esophagus. And like I said, you can have no acid. So the acid levels can be very low. And what comes up is not registered, but it also includes pepsin and lipid-laden macrophages. So again, other things besides acid can cause irritation to the lungs. Now, unfortunately, taking these over-the-counter anti-acid medications or reflux medications, like I said, it doesn't address reflux at all, because what's coming up is you're forcefully sucking up your normal stomach juice into your throat. So lowering the acid production is not going to take care of the reflux. And also, the most commonly prescribed medications are the proton pump inhibitors, like Prilosec or Prevacid. And these have lots of side effects, such as osteoporosis, dementia, B12 deficiency, and even kidney or liver damage. So there's been a sharp decline in the use of prescription of these medications. Now, sometimes the problem is that you don't make enough stomach acid. And so what happens is that food just lingers in your stomach for more of it to come up. And this is why apple cider vinegar can sometimes help with acid reflux and other digestive problems. Now, there are also many medications that can cause your stomach to shut down, especially those with what are called anticholinergic properties, such as with Benadryl and various other medications to treat bladder conditions, musculoskeletal problems, and even COPD medications. So again, back to the medication list. So this is why I'm so adamant that you should stop eating or snacking within 3 to 4 hours of bedtime. Now, if you're still having problems, then get tested for sleep apnea or URS, which is what I talked about before, and get that treated, since this will prevent you from sucking up your juices into your throat. Now, here's one bonus condition that's related to the last condition. This is a common condition called the period flu, which is related to PMS in women. And you can have various flu-like symptoms in women with throat pain a few days before the periods. For the men here, if you have daughters, this will probably affect you as well. So I wrote about this about 13 years ago on my blog with over 1,000 comments so far, which is the highest number for any of my blogs. And what happens is that right before your periods, your progesterone levels drop. And one of the benefits of progesterone is that it helps to tense tongue muscles, gives it more muscle tone. So as the muscle tone drops before your periods, the tongue falls back more often and you have more apnea events. So you suck up more stomach juices into your throat. And this can also go, like I said, it can also go into your nose. And nasal congestion is one of the more common symptoms of period flu. And the way you treat this is the same way that you treat acid reflux or sleep apnea or URS, the same steps that we talked about multiple times in the past. This is Dr. Park. I hope you found this video helpful. Are you still struggling to get a good night's sleep despite trying everything under the sun? Are you tired of waking up many times at night and have no energy during the day? Are you frustrated with doctors who are not helpful or aren't willing to listen to you? Is all this negatively affecting your job, your relationships, and your life in general? If any of this describes you, then think about working with me through my coaching program. Schedule your free consultation and strategy session with me by clicking on the link up here or down below. It's a $500 value for free. If you want to jumpstart improving your sleep quality to get your life back again, take action now by scheduling your session to discover what you need to do and to see if we're a good fit together and if I can help you. Spots are limited, so make your appointment now.